Welcome to the Innovation Office. I'm Sara.
And I'm Marco.
John wanted to build more things like this. And it takes a lot of different teams in order to create something like that. So for a game like that, you need designers, you need engineers, you need the scientists, neuroscientists, neurologists, you need the patients, and you need to bring all those people together under one roof. And typically, those people are not all in the same place. If you have a science research institute, for example, you don't have a lot of those design groups, and maybe you don't have the engineers that you need. So the vision was to create a space where we can have a neurotech clinic, and then also an innovation space where you have those different teams that then you could use for a variety of different projects, and then also maybe other startups that want to test their technologies, and then next to research and development as well. So bringing that all together into one space. So that's what we're building at the Champollion. It's complicated because what we have at the Champollion Foundation is that we have a lot of fundamental research.
Yep.
So we have scientists that have spent their entire career doing research, not necessarily thinking about how to translate that research into innovation. So really one of the first steps there is just bringing in people that have that industry experience, that know how to create a development plan, and also to have the scientists think a little bit more commercially about their work. Another tool that we built recently, which is not exactly neuro-focused, but it is a digital tool, is the Cinderella project, which maybe you know.
Yeah, I know.
So that's led by the breast unit at the Champollion Foundation, and it's an app that allows women that are going for breast surgery to see what their body is going to look like after the surgery. Right now, it's just there's shown images of women with similar body types to them before and after their surgery, but they're going to be incorporating AI so that the woman will be able to see her own body before and after the surgery and the different types of outcomes that are possible, and then they actually have the chance to say what they would prefer. One of the main lessons now I have learned after being at the Champollion for about a year and a half is to have a bit more patience with everyone. Because I also know how long it took me to upskill when I left the academic world and then when I started my first company. So I had worked in startups before as like the first employee of 2 startups before starting my business. And I then started my business as the CEO. So I came from being pure scientist and just doing science in those companies to now trying to learn how to be a business person. One strategy I'm using is just exposing them to other successful entrepreneurs, because I do find sometimes, even though I have the experience, I am a scientist turned entrepreneur, and now I'm trying to help scientists become entrepreneurs. You know, it's not if you build it, they will come. It's really find out if they want it, and then go build it, and then they will come. Because a lot of times it's very easy to just tinker in the lab endlessly and then come out into the world and be like, look, we built this. And everyone's like, oh, we didn't need that. I think a digital therapeutic needs to be approached exactly the same way as a therapeutic. So thinking, the playbook is there. It's like we just look to pharma and we see what they do for the regular drugs, and then we need to do that for the digital product as well. So you need to do your market access as early as possible. And you need to be involving all these stakeholders really early, figuring out who's going to pay for it, and working with those insurers very early to understand what outcomes they need to see, which is very commonly overlooked because it's like, well, we're going to make we're going to make a game, and we don't need to involve anyone in it because it's going to be less cost. So therefore, it'll be easier. But it's really that the pharma has figured it out. They know how to do market access. They know how to talk to all the doctors that they need to in order to get that drug prescribed. I went to science school. I didn't go to business school. So hearing about these things, it's like totally foreign. And so naturally, the way that you think about something when it's new is you sort of think about it as simply as possible. So it's like, oh, go to market strategy. Well, I'm selling a product, so I just make the sales. And the patient is the customer. And you're like, no, it is not. And there's all these other levels. And it's a hard thing to learn, and they're very reluctant to do it because it's not necessarily what they want to focus on. I'm the only scientist in the group of friends. And so I get asked a lot of questions about science, and I explain things to my friends, and they say that I do a very good job explaining. And they're like, I was like, okay, maybe more people want to hear my explanations on different types of science topics. So I started writing, and I chose longevity and psychedelics because my PhD was in epigenetics, which is now very tightly tied with longevity. And I also done a small research project on psychedelics as well. So I looked at the effects of MDMA on the rat brain. And I wanted to dive back into those areas and see what was going on in the field, because I sort of stepped away from those areas after my PhD for about 8 years. And then I was really kind of just out of the space. So it was a way to keep me updated and also to then educate.